and welcome. It's 11 a.m. here in Seoul. I'm Choi Jung-yun at the Arirang News Center. We're breaking into our regular programming to bring you a live briefing from the South Korean health authorities on the COVID-19 outbreak. In just a few moments, we'll cut into the briefing at the Sejong Government Complex with simultaneous interpretation in English. Yoon Tae-ho, the overall officer of disinfection at the Central Disaster Management Headquarters, will be briefing us on the coronavirus situation here in the country. He will fill us in on the number of new infections as of midnight and the efforts that the government is making to contain the virus. To give you a brief idea as we wait, South Korea reported 398 new cases of COVID-19 on Friday. Of the new cases, 381 were locally transmitted and 17 were from overseas. It looks like Yoon Tae-ho has taken to the podium, so let's take a listen.
First of all, here is Mr. Yoon Tae-ho with explanation on the COVID-19 response here in South Korea. Let us now begin our regular briefing for March 5th, Friday. As of today midnight, we have 381 new local infections and 17 new imported cases. And we had 8 additional fatalities, and I extend my deepest condolences to the deceased and the members of the bereaved families. First of all, here are some updates on our medical capacity. With the hospital beds being more secure, we have about 540 beds available for intensive care units, and we also have about 11,000 beds available for light and mild symptoms, and there are 0 patients who are waiting to be admitted to the hospitals. And here are quarantine updates as well. We carried out about 67,000 tests on those people with suspicious symptoms. And at the testing sites, we carried out 37,000 tests, while about 30,000 additional tests were conducted at the makeshift testing centers. Moreover, we are exerting our full efforts to come up with and to identify the places that are described as 3C situations that are a confined, crowded, and close environment. And we are also cooperating with the related ministries so that we can encourage more testings for migrant workers. And please note that these migrant workers would not face any discriminations after being tested. So we ask for your participation as well as the participation of the employers as well. And we will be discussing about the improvement in the visits to the nursing hospitals and care facilities. And in principle, all of these nursing homes and nursing hospitals are subject to non-face-to-face visits. And also, at these facilities and hospitals, they are also prohibiting visitors and in order to contain the further spread of the virus. And this had also increased the inconvenience and worries about these family members and the inpatients. And to this end, the government will be revamping the guidelines. And we also advise these facilities to carry out non-face-to-face visits. And starting from next Tuesday, we will also ask all of these nursing hospitals and nursing homes to resume visits at places that have great ventilation services. And also, we will be making sure that we can minimize the further transmission of the virus by looking at their conditions on a regular basis. And moreover, if an inpatient is nearing his death, or if also a medical doctor says that this person is in need of such visits due to other many reasons, including psychological reasons, we will also enable face-to-face visits with the protective gears available for the visitors and the inpatients. And this will only be available for those visitors who can submit a PCR negative document, or either those who can get a swift PCR testing at the hospitals or the facility. And as for the detailed guidelines, they will be revealed to the public through associations and also hospitals going forward. And so we ask you to comply with such quarantine measures and guidelines in order to help us prevent further viral transmissions at these nursing homes and nursing hospitals. And the government is also exerting its full efforts to utilize IT technology in combating the COVID-19. And as we said on the 19th of February, we have also rolled out and introduced the concept of the personal unique identification number, which is something that you could utilize instead of your mobile phone number. And this can also help you to protect your personal information. And this relief number can also be easily accessible through QR code. And if you can memorize this digit of numbers, you can also use them instead of having to download such related applications. And we also have a hotline, and we also ask for your cooperation in utilizing these as well. And this is a 6-digit number. And if you call this number, you could also register your entry log to facilities like public facilities as well. And this also will be utilized about 8 times. This has been utilized 8,000 times so far, including multi-use facilities like restaurants and cafes. And all of the users to these multi-use facilities are subject to writing their names in the entry log. Please note that writing your information can help us to track down the contacts as well as prevent the further viral transmissions in our local community. And please utilize these IT technologies going forward as well. And the government, in order to contain further local transmissions, we are also supporting non-face-to-face meets and support. Moreover, one of the representative examples was the free video call, which has been utilized by more than 6 million people, which was about 2 times more than those utilized during the last year as well. And during the Lunar New Year holiday, we saw that many family members utilized this free video call services. And starting from last April to this February, we have supported also details of more than 4,000 of such remote services for the religious facilities. And please, if you need further information, please contact the related call center as well. And we have been noting that many places of worship have been exerting their full efforts to contain the virus. And thanks to these efforts, we have seen a major decline in the further outbreaks at these places of worship. And for us to continue and maintain such low number of new cluster infections stemming from these churches and other religious centers, we ask for your continued cooperation as well. And starting from last Friday until yesterday, we have had a total of 225,853 people have been administered with their first dose of COVID-19. And this comes against the backdrop of the kickoff of many of the school year for our schoolers, as well as the many people who have also been administered with the COVID-19 vaccines at the nursing homes and care facilities. Nevertheless, we are seeing our daily cases hovering around 300 to 400 range. And if we look at overseas, we are seeing a rebound in the number of cases even after inoculation. And this is due to a moment of complacency. And we also noted that in just 4 weeks end of last year, our daily tally, which hovered around 400, jumped to about 1,000 in just 4 weeks. So going on, we ask you to also comply with the quarantine measures stringently to contain the virus further. And with the full-fledged carrying out of the vaccinations, we have seen many reports of the adverse reactions after the inoculation. And we also have seen overseas that more than 200 million people have been administered with the COVID-19 vaccines. However, if we look at the advanced countries overseas, we see that there were 0 cases of death that have been related to the COVID-19 vaccine. And we will also give you the transparent and clear information regarding the causal relationship between the post-inoculation deaths as well with the COVID-19 vaccines. Please note that the COVID-19 vaccine is a measure for us to contain the further spread of the virus here in the country. So if you are in the eligible group of people who to be inoculated, please also visit your doctor before getting inoculated and participate in such inoculation. And we are seeing also an increase of foot traffic. And during the weekend, we also expect many people to cluster and to be crowded at multi-use facilities, including shopping malls and department stores and so forth. So we ask all of the managers of these multi-use facilities to also take particular precautions to reduce the risks of infection, and the government will also exert its full efforts, especially pan-government efforts, to contain the virus. Thank you very much.
That was a government briefing on the COVID-19 situation here in the country. South Korea reported 398 new cases of COVID-19 on Friday, and this brings the accumulated number of COVID cases to 91,638. There have been 8 more deaths, raising the death toll to 1,627. We'll wrap up the coverage here, and we'll be back at 12 p.m. Korea time with our midday news with Mark Broom. Bye for now.